So good afternoon, everybody. As if our challenges were not enough, I think one of the most challenging session is the session before lunch. It keeps you away, and I don't want to kind of come in between the lunch. First of all, welcome to the OCCUCON 23. It's my proud privilege to be out here speaking across on this forum. A big thank you to the Indian Association for Occupational Health for inviting me and being there out to speak about the topic about creating healthy best practices. Just want to check if I'm audible at the back. Dr. Rajat, am I audible? Perfect. Thank you so much. All right. So Dr. Sriniket has given a lucid overview of how we can create healthy workplaces. I'm not going to talk about the structure as well as the framework of healthy workplaces. I'm going to talk today about building a culture of health and well-being. And to all of us as leaders, what we are ultimately aiming is to shift the needle and build up a culture going forward. So today, I'm going to talk about a few programs which has helped us go forward on the healthy workplace concept. As I begin, this presentation is going to focus on the overall framework, but we will be touching on the specific concepts which make a huge difference. Just to introduce GSK, the organization for which I work, GSK is one of the largest pharmaceutical companies, vaccine companies, and it has been having its presence in more than 100 countries. In India, earlier, the brands which included were Horlicks, now part of Unilever. But we also have several medicines and vaccines which are a part of the GSK portfolio. For us, the biggest thing is about how do we kind of get ahead of disease. But if we want to get out there, we need to first begin with our employees. Employees form a key focus for us. As Dr. Parekh said in the morning, it's employee health and well-being is a key priority, and that's what will shift the difference for us. Thriving people, we want to ensure that people are able to thrive in the work, at the work, and outside of work. If we are able to kind of create a healthy work-life balance, it's going to take a great way in the terms of engagement and productivity. The well-being support just does not need to be physical, psychosocial. It also now extends into all aspects of your life. And yesterday, we also talked about the financial well-being session which was there. Now, as we focus on health and well-being, I think it's integral that it needs to be linked to the goals, the mission, and the vision of the organization. Until and unless health and well-being is clearly a part of the stated leadership ambition, the vision, the values, the policies, I think the difference is going to be considerably less. So the three things which matter is, first of all, a leadership vision. The second is about having a very clear execution plan where it talks about engagement. And the third is about building the culture. And the culture only comes if programs have a utilization in their own. So Dr. Sriniket beautifully explained about the healthy workplace model. He talked about what are the different components, what are the different kind of things which come into matter. It's about leadership, the ethics, the values, the worker involvement. Yesterday, we had a fantastic professional development course on healthy workplaces where we covered the components and how companies are actually utilizing that to the fore. Today, I'm going to talk about some of the GSK health and well-being programs. In order to ensure that health and well-being reaches each and every employee, we have kept a very simple way of the framework, which has something for the employees and something for the managers and leaders. The employee journey would be beginning with the way how they understand health and well-being as a concept end to end. So when we say health and well-being, it includes health promotion, prevention, occupational health, mental health, chronic lifestyle diseases, rehabilitation, and also return to fitness. So my well-being as a module focuses on how employees can really build up their well-being for a personal self. We have partnership for prevention, which focuses on the preventative aspects and taking it forward. We have mindfulness. We have employee assistance programs. We have mental health matters. And we also have a bouquet of other programs, which I think I'll be touching briefly today. Now, the program which I wanted to focus today is Partnership for Prevention. It's a very unique program where we have focused on the key aspect of preventative healthcare and how it can make a difference, both in the terms of engagement, productivity, and also the entire business case for organizations. So before I actually embark on this program, this is an interesting slide, and this is something which is there for all of us. I call it as the workplace challenge, and this is based on Tower Watson's data, which said that if you look at the organizations, every organization is having 4 groups of people. People who are well, they're absolutely fine, no problems at this moment of time. People who are at risk, people who have turned ill, and people who are long-term disabled. Now, let's kind of think about ourselves. And for all of us who have become employed, at some moment of time when we were early in our journey, we were all well. And this is the 20% people, roughly around the age of 30, 35, absolutely things going on fine, no problems, we are well. But as age progresses, the risk factors start coming in. As yesterday we heard about smoking, sitting is the new smoking and we need to keep on moving. The risk factors, when they start coming across, then this is the age group roughly between 30 to 40 or 45, where people are having risk factors which, if this is not controlled, can manifest into an illness state. We have 20% of people who actually fall into the illness state where we are taking treatment for diseases like diabetes, hypertension, heart disease, and so on. And there are 5% of the people who also get into a long-term disabled state. And this is a state which none of us want to be into. So for organizations, if they really want to build a health and well-being culture, we need to shift the needle towards the left part, which is the well part. And this is the well-being continuity. This is where our focus needs to be. I think if we need to think forward in the future-ready state, we need to start focusing much more on the well-being aspect. Now, while I say this, I'm equally cognizant that when we look at our own benefits proposals out in our organizations, we have something which is called as the government medical support. Each of us out in India and several parts of the world have access to government health support. At the bottom, we also have a company-linked insurance plan, which actually covers certain aspects of it, the hospitalization part of it. Now, there's a big group in between, which is not covered, and this typically is around vaccinations, preventive health checkups. This is an area which actually is not clearly defined even in the insurance policies. Now, while I say this, some of the organizations have started covering that, but where we felt at GSK we can bring in the key difference is about ensuring that we provide employees with a seamless coverage through and through for everything which was not covered by the earlier policies. So, we actually thought about how will this really make a difference, and this data, again, coming from Tower Watson, is talking about the effect of what can be the effect from a numbers point of view. Yesterday I said, what gets measured gets done, and leaders love to actually also see the quantifiable figures on each aspects. So this is the data which said that if we are not going to work on any kind of preventative aspects, the premiums represented by the red line out here are going to significantly increase over a period of 10 years. Now, if we are going to improve the benefits by 10%, we are going to still have an increase, but that's going to be on the orange line. The best aspect is if we are all going to introduce preventative measures in addition to keeping the benefits unchanged, we might be having a significant change on the cost also. Now, let me emphasize, it's not about the cost always. It's about the quality of living. It's also about the quality of work. And it's about making a difference ultimately over a period of times. So with this data, we talked about what's the wellness barrier. We talked about what's reducing or what's not available. And with a clear data which demonstrates how this is going forward, we embarked on something which we called as the Partnership for Prevention program. Now, the origin of this program came from a fact that the employees' feedback said to us, hey guys, we are having a lot of different programs and benefits, but as one of the leading healthcare companies, can GSK also do something about providing vaccinations and other services to the employees? So in 2015-16, we embarked on a pilot where we said that let's try to kind of do this in 4 different countries across different parts of the world, Latin America, Africa, Asia, and then think about what does it mean for us. Now, the key thing which was important is we linked this to the WHO recommendations, to the principles, and we went into these countries and worked on what are the missing parts on the health-related benefits to each of these employees. The pilot showed excellent results, and after a period of a year, we found not only great results in the terms of utilization, but the employee feedback was very positive. This actually helped us to kind of scale this up into 100+ countries where we are implementing this. And as you can see, these are some of the services which we are offering to our employees. Now, the beautiful part is, for all of us who work in organizations, many a times, while we would love to do this, but then the bigger question is about the budgets. How do we get it? And in an ever-changing world, we need to still continue to get budgets from the senior leadership. Now, for all of my friends who also are having remits which spans multiple countries, and one of the challenges is, in a smaller market, it's not easy to implement programs. So here we kind of worked on our own way. We understood that if we need to get this program to everyone, this needs to come from the CEO's budget. If it's not a part of the LOC, if it's not part of the country's budget, it was much more easier to implement. So we worked with the leadership, we explained them the proof of concept, and finally it came out from the CEO budgets. So in the last several years, when business has been continuously changing, COVID has been there, it still continues to be there, is a strong conviction of how the company believes in the health and well-being of the people. Now, what was also interesting is that when we spanned the world, wherever GSK was represented, the needs were very differing. What was the need of the emerging markets was definitely not the same out in established markets. So we went to each market, we did a diagnosis phase where we talked about what is the need in, say, for example, Asia or Africa, vis-a-vis what is the need and the availability out in Americas. Based on the needs and the diagnosis, we identified what are the different services, how do we need to implement it, and in a phased manner over 4 years, we now have made this as a part of the benefits program, and this is now integrated into the HR benefits program. So this is the range of 40 preventive services which we have been providing. And I think the best part is that this includes child immunizations, adult immunizations, many of this which might not be covered by our OPD setups or even by the total medical insurance plans. It also includes preventive examinations. It also includes HIV/AIDS screening and treatment, prenatal care, cancer screenings, and so on. I think the best part out here is all of this is available to our employees free of cost. We are tied up with vendors across the countries, and this has been available through a wide range of hospital networks out in India as well. So the other good thing is this is also available to all of the dependents, and I think GSK is one of the few organizations which have really invested into all of these preventive health services in a sustained manner. Now, some of the highlights, and I think this work has been going on at different places. We partner across with the local engagement teams to make this possible. It has really made a difference. We have received some great feedback coming in from people. In India, if, as an example, if yoga is relevant, so we do yoga. In China, it might be Tai Chi. Similarly, we have things which might be going across in Indonesia. If smoking is prevalent, we have also tried to identify what we can be doing from a smoking cessation perspective. Now, the P4P program has been really instrumental in the terms of our own engagement, but it has also helped us deliver on the employee value proposition. It has helped us to kind of focus on what we say and what we truly walk, the mission and the values of GSK. In the end, I would say that this program has helped us go really good on the entire initiatives. We have had more than 200,000 lives who have got impacted through this program, and it has been wonderfully utilized across the world. I'm going to also quickly talk about mental health and well-being. another important area where we are focusing and where we are trying to have the bigger change. I talked about mental health and well-being. I think the key about getting mental health and well-being is to ensure that organizations open up to the dialogue of mental health and well-being. What's difficult is the stigma attached to it. And I think what each of us needs to work about is how we are able to create more dialogue and conversation into the organizations. So establishing an environment, creating relevant and accessible resources. But I think the center part, which is about supporting managers, is the most important going forward. We have had programs on My Wellbeing. It's about taking care of yourself or what you can be doing for each of you. It talks about energy behaviors. It talks about resilience strategies. We have worked in the past with Human Performance Institute, an affiliate of Jain, and we have done some great programs on energy for performance, My Wellbeing Essentials, and so on. This current module is a 4-week live module where people are taken through a journey on what are the different aspects of well-being, physical, emotional, mental, and the psychosocial aspect, including. All of this is linked to purpose so that this can be sustainable in the future. Mindfulness. Mindfulness definitely helps us to be much more present, much more productive. We organize mindfulness sessions. These are very tailored, compact, but very impactful sessions which are happening on a daily, weekly basis and are available free of cost to the employees. Employee assistance program. We yesterday talked about how valuable an employee assistance program has been, especially in the COVID times. GSK also continues to have that. But where I would like to focus is about the manager's mental health. Now, what was very interesting for us to observe is, while leaders are really keen to focus on mental health, while employees are there to talk or perhaps sometimes come out on mental health issues, the managers need to be sensitized about their role on mental health issues. So the manager's mental health module is something which has helped us to introduce the topic, what managers can do to identify this further early, and then flag it to the right resources, whether it's occupational health or through the EAP, to take it forward. So I think all of this has helped us to kind of make a huge kind of impact for us. For us, the most valuable thing is the GSK survey. The feedback of the employees is what we really deeply concerned think about. And I think there has been some amazing feedback which has come in from different quarters. This is an example of some of the employee feedback from different places, Kuwait, Mexico. Similarly, we have had a lot of interesting engagement on our health and well-being in different places, whether it's Costa Rica, Abu Dhabi. Going forward, different parts of the world, again, it's something which makes us really proud. Nobody does this for employees in the industry. It's really an amazing feeling if your employees value what you have created and how it's working for them. Thankfully, the employee feedback has been great, but we have also been lucky to actually be having some recognitions. I should say that the Global Healthy Workplace is not the only one. We have received it twice, and I think I see that there are several organizations. Unilever has won this as well. Procter & Gamble, Reliance have also already been there, and we have on the podium many other organizations who have done this. GSK has also been a recipient of several other recognitions as well. So I think as I come to the end, I need to acknowledge the work which has been done by all of my GSK colleagues who have been there in GSK, but I also see them out here in the audience. Thanks a lot, Dr. Albert, Dr. Glocko, Dr. Andrew, Dr. Ashish Arora, and Dr. Ramanjeet for your valuable contributions in creating a healthier workplace. Thank you so much.